Bismillahirrahmanirrahim. So today we are going to discuss about the challenging ABGs, and this is actually the challenge, and you can diagnose this case if you know about my previous lectures regarding the ABGs. So 17-year-old male, I received this patient in the ER. So 17-year-old male with no previous comorbids. Well, he presented with the chief complaint of loose motion that was associated with fever, low-grade fever 100 and 101 and 102, without rigors and chills for the last 5 days. He is also having shortness of breath for the last 1 day, but no cough, no sputum. And SpO2 when I checked at room air was 71%. Well, the chest X-ray was actually normal bilaterally, but if you focus on the right hilar region, there was increased opacity, and this opacity was actually, as we know that the chest is a three-dimensional structure, and the chest X-ray is actually this two-dimensional representation of three-dimensional structure. So there was opacity in the right hilum. Most probably this hilum opacity was lying an infection lying posterior to the hilum. That should be confirmed on the CT scan. So I did ABGs of this patient. Let's move toward the ABGs. So this is the ABGs. The pH is 7.25, the PCO2 is 9, and the bicarb is 4. Now if you focus on it, the CO2 is moving downward, the bicarb is moving downward, and look at the oxygen, that is 126. So it gave us an idea that the ABGs was done on oxygen. On oxygen, the ABGs were done on the oxygen. So increased O2 was supposed to give high CO2, and the patient was having hypoxemia. So without wasting our time, let's go toward the other findings. So the bicarbonate is 4, the CO2 is 9. Now if you look at the pH, that is acidotic. So applying the knowledge of our previous lectures as we discussed in the ABGs med gupshup, so the pH, so which one, if the both arrows are moving downward, which arrow is a primary pathology? So we can get that from the looking at the pH. The bicarb is downward, the bicarb here is downward, and the CO2 here is downward. So we know that. Now look at the pH. Primary arrow, how can we find it? We already discussed in the previous video. So the pH is acidotic. If the pH is acidotic, so which the decrease of which of these causes acidotic pH? Decrease of CO2 causes acidosis? No, it causes alkalosis. The decrease of bicarbonate causes acidosis? Yes. This is the primary pathology is actually this one, the decrease in bicarb. So this is metabolic acidosis. But why the CO2 is decreased? Is it compensation, or is it also the primary pathology? So we have to apply the formula, Venter's formula. So we applied the Venter's formula, that is 1.5 into bicarb plus 8 plus minus 2, and that came out to be 12 to 16. Now this is the expected CO2. This is the expected CO2. But what is the CO2 in ABGs? That is 9. So that is less than the range. If it was in the range, that was compensation. If that is less than the range, so it means the decrease in CO2 causes what? Alkalosis. So this is respiratory alkalosis. What was the idea behind this? The total idea behind this was mixed acid-base disorder. This was mixed acid-base disorder. That is metabolic acidosis with respiratory alkalosis. Metabolic acidosis with respiratory alkalosis. How did you find that it was mixed? By applying formula and by looking at the primary pathology arrow. Now why he's having metabolic acidosis was due to severe sepsis. This patient was having deranged LFTs, deranged RFTs. He was not maintaining BP, and he was having warm peripheries. So metabolic acidosis can be explained due to lactic acidosis. But why there is respiratory alkalosis? Respiratory alkalosis of this range was expected, but respiratory alkalosis of this range was not expected. Now let's move to the reason of this respiratory alkalosis. The SpO2 of this patient was 71. That was pretty low. So what it did, it stimulate respiratory center. Why it stimulate respiratory center? To get in more oxygen, to get more oxygen, What happened in response? Patient washed out CO2. The patient washed out CO2. So this was actually respiratory alkalosis. The one reason was this. The second reason was the patient was having abdominal pain, and we know that abdominal pain causes what? Increased respiratory rate. So that also CO2 wash out. So that also washes the CO2. Now let's move toward the Abgs which were done on the second day of admission. So these were the Abgs done on the second day, and this patient was started on IV antibiotics. Yet we did not know the bug, so we covered the 360 angle, the vancomycin, the tenzo, and the azithro, thinking of atypical pneumonia because diarrhea with pneumonia. So now, if you see the pH, that is 7.43. So the acidosis is improved. The pH is now in the normal range. So if the pH is in the normal range, it means it is normal. What do you think? No, it is not normal. Look at the bicarb value and look at the CO2 value. The normal pH with abnormal CO2 and bicarb values mean mixed acid-base disorder. So the pH is of course normal, but we have to focus on the CO2 and bicarb. Look at the CO2, that is decreased, and look at the bicarb, that is also decreased. Now, which one is the primary arrow in this Abgs? To look for the primary arrow, you have to look at the pH. Now CO2 is decreased, bicarb is decreased, both are decreased, but look at the pH, that is 7.43. It means that is an alkalotic site. If the pH is on alkalotic site, then which arrow causes alkalosis? Decrease of CO2 causes alkalosis, or decrease of bicarb causes alkalosis? Decrease of bicarb causes acidosis, while the decrease of CO2 causes alkalosis. So this is the primary arrow over here is decrease in CO2. The decrease in CO2, while the decrease in bicarb. Now we have to look whether the decrease in bicarb is a compensation for the respiratory alkalosis, or that is concomitant metabolic acidosis. We have already studied the formula and we will apply that. Till now we know from the previous data that this patient is having mixed acid-base disorder. So these were the Abgs done on the second day. So acute respiratory alkalosis, because the history is short. So the decrease in 10 CO2 decreased bicarb by 2. So here the CO2 is decreased by 30. So the expected bicarb was, for 10 if it is 2, for 30 it should be 2 plus 2 plus 2, 6. So 24 minus 6, 18. Expected bicarb was 18. So here bicarb is 9.2. So it means patient is having metabolic acidosis. And we already know from the previous discussion that this patient has a metabolic acidosis with respiratory alkalosis. So there was metabolic acidosis versus respiratory alkalosis. So there was a war between these two, and it depends upon the severity of the disease, that which disease is more severe. Either metabolic acidosis is very severe, so it will run the pH, on acidotic side, or the respiratory alkalosis is more powerful, so it will run the pH. Now previously the pH was run by metabolic acidosis. Now the pH is run by respiratory alkalosis, because the pH is alkalotic. If the pH is alkalotic, so the reason for the alkalotic pH is not the decrease in bicarb, because decrease in bicarb will cause acidotic pH. So coming toward the Abgs back. Now the Abgs on the left side, that were done on the same day. Focus over here. Now you see the pH is decreased, the CO2 is increased, the bicarb is increased. So the bicarb is increased, the pH was supposed to be increased more, because the bicarb is increased. focus a little deep concept. Bicarb is 9.2, here it is 12.4, so the bicarb is increased. The pH was supposed to be increased because bicarb is alkali. If it is alkali and the alkali is increasing in the blood, so it will increases the pH to alkalotic side. But the pH is decreased. Why? Now look at the CO2. CO2 is 13, but here the CO2 is 23. So the CO2 is increased. The drop in pH is actually due to the increase in CO2, and this shows the impending respiratory failure. It shows, this is very important point, the increase in pH, the decrease in pH without the decrease in the increase in CO2 without rising pH shows respiratory failure. So the increase in CO2, of course here the CO2 is increased from 33 to 23, and the bicarb was also increased. If the bicarb was increased, the pH was supposed to be increased. The increase in CO2 without rising in pH, without rising in pH, the increase in CO2 without rising in pH, that shows what? Respiratory failure. What is your work now? ICU. Involve the ICU. Involve the ICU. Because he is having increase in respiratory rate for two reasons. First one is a compensation for severe metabolic acidosis. Second one is hypoxemia. To fight the hypoxemia, he will have to take in more oxygen. In order to take in more oxygen, he is washing the CO2 more. So there is a double stimulus for this, and he also was having pain. So there are three things actually: compensation, hypoxemia. So this patient was a candidate for ventilator in ICU, but unfortunately there were no beds.